Have you ever wondered how AI is reshaping the way we diagnose and treat medical conditions? Well, you're about to discover numerous innovations that are accessible and usable right now. Today, we're diving deep into the revolutionary advancements that AI, including ChatGPT, is bringing to the medical field. From a young boy named Alex, whose mysterious condition baffled 17 doctors, to the groundbreaking technology allowing a paralyzed woman to express herself through a digital avatar, we're exploring it all. Let's start with the transformative impact of ChatGPT in ophthalmology. Now, would you be surprised to hear that ChatGPT can now act as a virtual assistant to eye care professionals and a reliable diagnostician for patients? Well, I'm not. Let's talk about what Riley Lyons, a fourth-year ophthalmology resident at Emory University School of Medicine, hinted. He often found out that before patients consulted him, they would have initially consulted Dr. Google first, and the internet tends to suggest many alarming and scary possibilities based on symptoms. However, Riley and two fellow ophthalmologists at Emory took an intriguing step. They decided to test ChatGPT's diagnostic accuracy for eye-related issues. To their surprise, the results, reported in June on medRxiv, showed that ChatGPT performed pretty well. It even outperformed the symptom checker on the widely used WebMD. This study found that the latest version made zero inaccurate claims when confronted with common eye complaints. According to Neeraj Jain, an assistant professor at the Emory Eye Centre, ChatGPT represents a significant improvement over a typical Google search. He states that the AI is not just a chatbot. It's a promising tool for identifying eye problems accurately, providing valuable insights, especially in the complex field of ophthalmology. Now let's explore how you can decode brainwaves to speech and expression with AI. Researchers at UC San Francisco and UC Berkeley have achieved something truly remarkable in the realm of healthcare. They've pioneered a brain-computer interface, or BCI, that enables a woman with severe paralysis from a brainstem stroke to regain her voice using a digital avatar AI. This achievement represents the first time both speech and facial expressions have been synthesized directly from brain signals, marking a profound advancement in medical technology. The system they've developed can decode these brain signals into text at a remarkable pace, nearly 80 words per minute, significantly improving existing technologies. This breakthrough, detailed in a recent publication in Nature, has the potential to lead to an FDA-approved system for speech restoration from brain signals in the near future. What's truly fascinating is that this technology goes beyond just decoding words. It deciphers the richness of speech and even the facial movements accompanying conversation. The process involves implanting a thin rectangle of electrodes onto the surface of the patient's brain, intercepting signals that would typically control muscles in the tongue, jaw, larynx, and face. These electrodes are connected to computers via a cable. The patient then collaborates with the research team to train the AI algorithms to recognize her unique brain signals for speech. Instead of teaching the AI entire words, they use a system that deciphers words from phonemes, the subunits of speech. This approach enhances accuracy and speed, making communication smoother and more natural. To create her voice, the researchers developed an algorithm that personalized her speech to sound like her voice before the injury. They also used software to animate the avatar's facial muscles, simulating natural expressions as she speaks. The result is a seamless integration of brain signals, synthesized speech, and lifelike facial movements. While this achievement is awe-inspiring, the researchers are not stopping here. Their next goal is to create a wireless version of the system, eliminating the need for physical connections. This could open up a world of possibilities, allowing people to control computers and phones independently, greatly enhancing their independence and social interactions. Now back to ChatGPT. Welcome to a new era in medical diagnosis and patient care. AI, particularly ChatGPT, is making profound strides in revolutionizing healthcare, especially in diagnosis. There is a case of a patient who saw 17 doctors over 3 years without answers. During the height of the COVID-19 pandemic, a concerned mother named Courtney noticed something troubling about her 4-year-old son, Alex. He was in pain, chewing on various objects, and not growing taller as he should. In 2021, Alex began showing imbalances between his left and right sides, often leading with his right foot while his left foot followed passively, as Courtney described it. Despite numerous visits to 17 doctors over 3 years, no one could pinpoint the issue plaguing Alex. That's when Courtney turned to ChatGPT for answers. Line by line, she entered the details from Alex's MRI notes into ChatGPT. She also mentioned that Alex couldn't sit cross-legged, which raised concerns of a potential structural problem. To everyone's surprise, ChatGPT proposed tethered cord syndrome, a neurological condition where the spinal cord attaches to the surrounding tissues of the spine. In a remarkable turn of events, ChatGPT provided the correct diagnosis that had eluded medical professionals. In a study, ChatGPT exhibited a remarkable 72% accuracy in overall clinical decision-making. It can identify possible diagnoses and assist in care decisions. This isn't replacing doctors. It's enhancing their capabilities and potentially reducing misdiagnoses and delays in treatment. ChatGPT isn't only used in medical diagnosis, it is also important in areas like medical research assistance, patient education, telemedicine, and language translation. Researchers can utilize ChatGPT to gather and synthesize medical literature efficiently. It can summarize complex research papers, helping scientists stay up to date with the latest findings. Also, ChatGPT can offer patients easy-to-understand explanations of medical conditions and treatment options. This empowers individuals to make informed decisions about their health. And that's not all. ChatGPT can serve as a virtual medical assistant during telemedicine appointments, helping doctors with note-taking, data retrieval, and providing relevant information to patients in real time. Up next is the fascinating creation of AI-powered tools that assist doctors in screening for conditions like depression, anxiety, and PTSD with incredible accuracy. Over in the UK, the National Health Service is taking a giant leap forward by deploying AI-driven mental health tools on a large scale. One standout example is Limbic, a British AI startup with a game-changing diagnostic tool. This tool has already screened over 210,000 patients and boasts an impressive 93% accuracy rate across the 8 most common mental disorders. So, how does it work? Limbic's Access chatbot equips psychologists and psychiatrists with invaluable information to assess a patient's condition, gauging its severity and urgency. The result? Fewer misdiagnoses and a remarkable 45% reduction in treatment changes. It's not just about streamlining the process, it's about enhancing patient care. But the AI revolution in mental health isn't confined to the UK. Across the pond in the US, health insurance companies are also getting in on the action. These AI-powered tools offer a ray of hope in tackling the ever-growing demand for mental health care. Recent studies, hot off the press on PubMed, reveal the incredible potential of these AI-driven tools. They've shown astounding accuracy in diagnosing mental health disorders and distress, often outperforming traditional screening programs. The secret sauce? These tools leverage vast datasets, combining video and audio files with clinical histories to train deep learning models. These tools aren't just reshaping how we approach mental health, they're extending a lifeline to millions who need it most. If you're as thrilled about these developments as I am, go ahead and give that like button a click. If you've watched this video all the way through, we'd love to hear your thoughts. Drop a comment below to let us know you've gained some insights from the content. For more interesting topics, subscribe and make sure you watch the recommended video that you see on the screen right now. Thanks for watching.